Welcome to Doc Secret, the show where we uncover the playbooks, strategies, and stories behind the most successful dental practices and the companies that serve them. This show is all about building the best practice, whether you're a dental or medical student dreaming of private practice, a seasoned doctor looking to grow or sell, or an investor exploring the healthcare space. This podcast is for you. I'm your host, Kevin Carl, and in today's episode, we're diving into the biggest challenges facing today's practices. Let's get started. Welcome to Doc Secret. Joining me today is Dr. Jaime Estrella, prosthodontist and co-founder of the True Smile Dental Implant Center in Chula Vista, California. Dr. Estrella, Jaime, if you will, welcome to the program.
Thank you, Kevin. Thank you for having me. It's an honor, and I'm excited for this conversation with you.
Great. Well, Jaime, welcome. Why don't you take us back, just to start us off here, take us back to the beginning. What inspired you and your brother to both pursue dentistry?
It was pretty easy. I mean, both of our parents were dentists in Tijuana, Mexico. So we grew up playing around in the dental office, right? I mean, I remember the smells, and it was everything very normal. And usually, you're not okay with those smells of a dental office, right? Or the drills or the sounds. But I mean, it was pretty easy. We grew up like racing on the dental chairs around it, my brother and myself. So it was very normal to us. It's kind of weird, I guess. I get it, but we know. I mean, we knew at the later on that we wanted something to do with science. In my perspective, I wanted a little bit more artistic, aesthetic too, and obviously helping more people, like personal connection around it. So dentistry became an easy option, obviously, because of my parents, and they were. My dad was a great dentist in Tijuana for several years, and he did great. If it wasn't for him, we wouldn't be here, obviously, with his guidance and tough love sometimes too that is needed. So, but it was very easy, very natural that evolved into to being a dentist. So it was second nature, in other words. Yeah, it was pretty cool.
Great. Well, what's the story then behind True Smile? How did you make that jump to True Smile? Share with us a little about that.
It's a little. We started. I was in my prosthodontic a specialty program in the early 2000s. So I was in the middle of that. My is 3 years older. So he was almost graduating from the implant program in Loma Linda, California. I was entering into the program in in Loma Linda, California. And one day I was studying there, and I remember my dad, I mean, calling me and saying, you know what, we already just got we're we're putting a deposit on a blank like real estate in Chula Vista, and because you guys are gonna start this, we're like, I don't know, okay, good, bad. I mean, it's you're young and dumb, excited, everything's good. You don't see what you don't see, right? So, um, and that's how it started in a nutshell. But once we I graduated, um my brother and myself started the practice from scratch. Literally, my dad was just like, "Here's the seed, boom, 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 is on you guys." Right? So that was a great thing, and I appreciate that. Um, because you learn by your mistakes a lot. We made a lot of mistakes, we still do. Um, but that's the best learning tool that you can get. Now, we did do dentistry, general dentistry, for almost what, 15 years. Well, general with touches of my specialty and my brother. We're doing implants here and there. I'm doing full mouth reconstruction on that natural dentition. And as you know, I mean, I came out of school and I wanted to do everything textbook, right? I mean, diagnostic, everything diagnosis, photographs, wax ups, everything perfect. And patients are like desperate, right? Like, when are you actually gonna work on my teeth or something like that, and then you come to a realization that it's not real life. It's not business. Even if you want to do the best for the patients, um, you need to learn the business side about it. So I know I'm stretching this story, but I'm gonna get to the point. So
Good.
uh,
No, this is what we want to hear.
yeah, it's we went to the point that we were doing okay. My brother was, I mean, we were doing good, but we were like, okay, what is it that we're not seeing, right? So we discover a management program of dental offices that's very well renowned by a friend and all of that. We went and we discovered the business side, right? So focus and specialize on what you want to do, right? I mean, do what you do good and delegate the rest, right? You're going to be happier. You're going to be doing better jobs. You're going to helping more people and you're going to be more like productive, right? And every single day, you're going to come to work and do what you love. And financially, you can do better because you're gonna explore. You're gonna be doing even more cases around it. So that changed our life. And that moment, we changed it to True Smile. Before it was Estrella Dental, that is basically our last name. It was Estrella Dental because legacy from my dad and everything like that. But everything changed, like marketing side, like how do we market? How do we have a punch on the name and all of that. So all of that, that's how True Smile really started here. And we converted into a dental implant center. That's all that we do. I mean, all on X, all on 4 cases every day. And from there on, we took off. And that's what we do day in, day out.
Well, that's great. That's
Yeah.
great, Jaime. You've talked a little bit about why Chula Vista. Now tell us a little bit about how your vision for the practice took shape. How did you and your brother divide leadership and clinical duties? Could you share some about that?
Yeah. Chula Vista is very familiar to us, right? I mean, I grew up in Tijuana, Mexico, so it's basically 5 minutes away from San Diego, from the U.S., right? So Chula Vista is the closest to it, um, urbanized, and we were familiar with it. Very young area at the time, still is, but not developed enough. A lot of construction, a lot of new money around it. So obviously, my dad, my brother, and myself, we're like, okay, this is the place. This is a place where people are going to be around. They're going to need dental services, good quality dental services. Obviously, there's money around it. So you want to be able to provide good quality service and be I mean, be financially compensated accordingly, right? So that's why Chula Vista, and especially in the East Lake area, that's the area that we're here and we still are. Now, how we would divide the duties between my brother and myself, it was pretty simple, pretty organic, honestly, because we already have specialties. He's an implant surgeon, I'm a prosthodontist. We didn't step into each other's feet. I mean, usually we come from the same school of thought that is Loma Linda. So we were trained actually by a lot of um, great mentors and doctors that taught us the same principles. So we have the same upbringing in that area. So we the same diagnosis, all of that. We talk to each other a lot. We're very different, my brother and myself. If you see us, we're very different. We're very different in a good way for business, obviously, and we tend to separate business very easily. So we're not afraid to do that. And honestly, we do it even more to that matter because we want to preserve our family.
Yeah.
That's
Yeah, that makes
that's what
sense.
it is. Yeah. So, for example, all the surgical procedures, my brother did them. I did all the restorative diagnosis. We did it together. Part of the selling, all of that, with the training. I love more of that, more of the patient contact and communication, and with the staff and all of that. So that's my forte, to be honest. I'm good at what I do. Don't get me wrong. I'm very good at doing frost. But I love the sales side, the business side, right? Like the marketing, the sales flows in the office. What do we do need to do? What's going on? How can we adjust? We see the key performance indicators that we see in the office and all of that. So it's very cool, and having really good communication and relationships within the patients and the office. That's my thing. That's what we do. So it's easy to delimitate what we do, what we don't. We still do that, honestly. For example, if I'm sending an email to someone who is for the both of us, we're like, okay, you're doing this, yeah, good. We get together, and we just one gets actions done. Otherwise, we feel that it can become very messy.
Sure, yeah. So speaking of that, what are some of the pros and cons of a family-run practice as you've experienced it?
Yeah, we're we're blessed that that we can do this, um, like we did, and we keep doing it because I know and I've seen other situations that don't work out and end up badly sometimes, or they just don't work out. For us, I like it. It's very good and very bad at the same time, right? So, like anything, because it's still a business. So, whenever there's money involved, you need to have, in my professional point of view, you have to have everything even clear, right? So, and agreements have to be there and respect them all the time, right? And if not, get together, create an agreement that you're going to respect, and then follow it up, right? So communication is key. I know that it's a boring answer, but it's communication is key in this type of things, and creating agreements that you're going to be happy with yourself and your families, because it's otherwise it becomes a nagging thing every single time that you come to work, and then after work, for example, if you have a family reunion or Thanksgiving or Christmas or something, like, you're gonna see them, right? You're gonna see them and your family. And take in mind that whatever I take from here, I'll take it to my wife and my kids and my families. So whenever we see each other, we're like, this is not working out, or something like that, right? Like you get the stinky eye or something like that. No, but we managed to talk to each other a lot. Um, and sometimes, and it has happened quite a few times, so like, what's going on? Close the door. We're sitting here until we figure this out, and so we can continue being brothers and being successful, whatever we have to do for the business, right? Because you need to keep in mind that the business is working for our families too. We're doing this for our families, right? So, so
So it sounds like you've got a priority in your relationship that overrides the business front. You want to make sure that the business is aligned to where you're headed as a family, keeping your family cohesive and working well together.
correct. Yeah, and it's not easy sometimes, honestly. I mean, it's not easy in general, even if you're not family. So being a family is, I see it more to the reason to be clear, right? So for example, if you have someone that is not family but is your business partner, sometimes you're like, oh, I don't want to ruin the relation. No, like more like go to it and go through it. Like make it clear. And if it's gonna work out, great. If it's not, great. Let me know early so we can
Do
figure it out.
wait, do
Yeah.
you you mentioned earlier, do you write that down? I got the impression that you were actually in some cases writing down agreements between you and your brother. Is that did I get
Kind
that
of.
right?
Some of them, yes. We write him down not with the purpose of like a legal binding contract or something like that. We more than anything we had. I remember we had a like a whiteboard and like a checklist, right? Like what are we doing today? Performance indicators. How's marketing doing? How's the finance doing? What are we doing? What's the next investment that we're gonna do for the office or out of the office, right? So, but we do it that way. So keep each other in check and get responsibilities and goals are aligned. Um, and if not, like put new goals online, and we did that. Okay, boom, let's get it and move on, right?
That makes sense. That makes a lot of sense. Helping motivate each other, keeping each other accountable. When you feel that internally, it really drives you, and that's great.
Yeah, that's very important, Kevin. I mean, it's I don't see I don't I cannot imagine being here alone, to be honest, and it's very weird because I have not experienced that, and I know because I have never been in a solo practitioner and business owner yet. Um, to the point that whenever you come in, I feel more responsibility, right? Like I need to come and deliver, right? For for my brother, for my staff, for my patients, for my family, for myself, right? Obviously. But having someone in the same like um alignment and goals and everything like that, it creates a little bit, it has a heavier weight on it on the things that you do. Like if you're not feeling it today in the office, right? And you see that he's doing surgery, like, "Ah, I don't know, man, I'm gonna take an early lunch." Like, no, I mean, like, you just came out of surgery, or vice versa, right? If you see me that I just closed a couple cases and you're just coming in here, like, okay, let's get it going. What are we doing today? I mean, let's so it promotes that productivity and gets you going, right? It gets you into action. It's like walking into a room and everybody is very excited and active and you're like down. I mean, you're like all of a sudden involved and going around and the activities are going around it. So it creates that kind of mood.
I mean, if I may, from your perspective on the ground in Southern California, what are the challenges, really the key challenges facing dental specialty practices today?
I mean, as you know, the rising cost of things, expense of living, especially in the on the border where we are, we're literally 5 minutes away from Mexico, right? So um the competition of dentistry or or health services in this area with Mexico, with Tijuana specifically, is tremendous. It's tremendous, man. I mean, it's because there's more need.
I assume there are a lot of people going south of the border for dental care. And so you're competing with both sides, practice on both sides of the border with Mexico. Is that correct?
Correct, fully. I mean, in to every extent, and obviously we're not gonna be able to treat everyone, unfortunately, um, but it's hard. It's hard because there's a lot of good dentists everywhere, as you know, and here and everywhere. There's gonna be good and bad everywhere. But whenever you're competing with the same type of dentistry or treatment in different places, but it's half the price, it's you have to be creative. You have to be very, very creative. The advantages that we have here is in the US basically is that you have way more financial options, obviously, for the patients to of methods of payment, a little bit more security for the patients in case of liability, right? Obviously, protection for them. Um, but as you know, the competition nowadays it becomes way more. Now, talking specialties about my specialty in specific, it's it's tricky because of prosthodontist that nobody knows what it is, right? It's a combination between a lot of things. Um, it's tricky because as a general dentist, you're not going to refer a lot of patients to a prosthodontist unless you don't know or you're tired of trying stuff that didn't work, right? And the last person that that patient wants to see is another dentist. So that's the type of referral that I get. A tired patient that it has tried a lot of stuff and they don't cannot do it anymore and just send it off, right? So it's almost like a vicious cycle. Why? Because patients want to pay less, obviously, with good reason, but get the best treatment, right? So whenever they come in here, um, they they diminish a little bit of the specialty, right? Because they don't know better. I mean, you just go in there and see what's going on. So it's hard as a prosthodontist. So that's why we jumped into a dental implant center, right? Um, so we can actually work on that niche that we know that we're very, very good and selective on within I mean, work like dentistry in general, right? I mean, there's I mean, only a few of us dental implant centers that we can do everything in one office, that we don't refer out for surgery. We don't refer out for restorative. We don't, we don't refer out to get anesthesiologists and get everything done in one place, right? So that was a big key to us. And that's a very good question because I didn't think about it until now, to be honest, to why we actually land in a dental implant center, right? Because other than being our specialty, is we eliminate a lot of competition immediately just by specializing on that, right? So it's still hard because nowadays, as you can see, all on four, all on X treatments is the new thing, right? The new boom, and so everybody's providing it now, and so it's still gonna go on, and but it's an ongoing thing.
So you now have a lot of competition in your area for your specialty?
Not for my specialty directly per se, and there's not many prosthodontists. There's a lot of all on four, all on X providers, not necessarily specialties. Providers. What it means is they either bring an oral surgeon or a periodontist or a prosthodontist, and they do the services in the office, and then they restore or do a variation of the treatment around it. Um, so that's the type of competition that we have. Why? Because it's a big ticket item too. It's a big ticket item. So you're gonna attract a lot of attention in a good way and a bad way. It comes with it, and you need to know who you are, and you need to know who you're not, and keep your integrity in place, and do what you do best, and go from there, and compete ethically around your profession.
Yeah, no, you've got to practice, right? You've got competition. What we've talked about and being a cost-effective provider and a great provider of services to this broader community that you're operating in there, uh, that's great. What about staffing? How do you build a team? How do you staff that team? How do you retain the best members of your team? How does that work for you?
It's tough. It's tough. Before the courses that we did, before when we were straight at dental, um, we didn't know much, to be honest. I didn't know anything. I thought having the best dental assistant was the highest that we even can get. We heard about office managers, treatment plan coordinators, PRs, marketing teams, all of that. It wasn't real to us. We went into the management companies, and you see different areas of a business, right? Let al- put aside dentistry, but of a business, you need to have an organized system around it that it supports you and holds you in place so you can do dentistry, right? So we started training our staff. We started training ourselves on how to hire, how to communicate with patients. Take in mind that whoever we're hiring, it's coming from the same pool of population that's around us, right? The same place where patients are coming in, that's the same place where our staff is coming in a nutshell, right? So who are you attracting? Who do you want to work with, right? Who do you want to work 8 hours a day, 4 or 5 days a week, and be comfortable with, right? So, I mean, it's almost like it's a big commitment. It's not like, oh yeah, we work together. Like, no, you need to trust and this person. They need to trust you, and you need to be open about it. So what we did is we open up what we do, right? These are our goals to the whole team. Like these are our goals. This is what we're doing. Who's online, who's not. Like, yeah, good. I'm online. I don't have no idea how do you want me to get there. Okay, I'll train you. I'll train you to it. Um, so what actually created is we have the same language in within the office, right? Every morning we do a morning huddle, and we explore how we did. We key performance indicators like collections, productions, new patients, marketing. What are the goals of today? I mean, what are the goals of the week? How are you doing? What are we doing in next week and everything like that? But we're open to that. We're open to exposing them on how are we doing financial wise, money, right?
So you bring your team into those conversations, those business
Mm-hmm.
conversations. Interesting.
Mm-hmm. Mm-hmm. Yeah. And it's hard because it's almost like a taboo, right? Like, oh, we don't speak about money within our employees, right? We don't, we don't, we don't talk about it. We don't know, we don't want them to know how well or how bad are we doing, right? But the, we find out that whenever we talk about that, they understand it. They're, they understand. I mean, then you get it, right? So it's easy. Everything becomes easier and clear because it's clear. There's no, there's no h there's you're not hiding anything. So the moment that you go in there and say, "You know what? This is the goal to the for the month. This is where we at. This is what we're gonna do. Boom, let's get to it." Instead of going blind, like, "Kevin, do this. Let's go." Like, "What are you doing? I'm working my hardest." I mean, like, "Yeah, but these are our goals." So you know what I mean? They get more understanding. They get a purpose, and they align by themselves, and we train them and we treat them the best that we can so they can work everywhere. Like Richard Branson said, like, treat him and train him so they can go anywhere, but treat them the best so they don't want, never want to leave, right? And you're always gonna get them. I mean, you're always gonna get a lot of people that, especially right now, is kind of weird, but that's a live different different interview. That right now, it's I feel that they're like 18 months, boom, what's next? I'm going to the next job, right? So, and our staff, well, my pillars and what we have here, my office manager, my production executive, my surgical producer, it's they've been with us for more than 7 years. So we we talk the same language. We we understand each other whenever we go into an command, like for example, a consultation with a patient. It's a nonverbal communication. It's a very coordinated and organic and natural dance now that we do. I mean, it's boom, 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 boom. Very seamless, right? Very concierge. Like for whenever you come in here, the patient feels like they notice that we know what we're doing. This is natural for us, right? It's natural for to have a nice flow, to talk about money. How are we going to help you financially so we can get your health back into to what you want and you can enjoy life for the rest of your life. It's natural. It's not like, oh, I don't know. I don't know. Let me see. Let me, like a car salesman, right? Let me talk to my manager and come back and like, this is the best off. No, it doesn't work that way. I mean, it's we really care. We care honestly about everything that we do here and we care about patients getting treated because that's the only way that we can actually help people, right? So
And at this point in time, are you hiring there in your office? Is that something that you're always doing?
always, always, we're always hiring good people. Always. We just hire cool story. My staff in the back, they're all trained dentists. They're actually trained dentists in Mexico, and organically happened that within each other, we started with one. My back office, my surgical assistant, she's a trained dentist in Mexico, and she loved what she does, and so she talked to their friends and hey, they're hiring. Okay, great, boom, and then another dentist, and another dentist, another dentist. So our job became way easier too for my brother and myself because we do train here, but they have the knowledge. They're already trained and have the knowledge, and they have the hunger and the desire because they're young dentists, right? It's like, for example, if I was in their age and I'm just coming out of the dental school, and they're like, you're gonna be training, you're gonna be working with a prosthodontist and an implant surgeon that have been doing it for 20 plus years, and they're gonna pay you. So basically, you're getting a specialty or at least a mentorship, and you're getting paid for it. So and I love it. I train him from start. I mean, from zero to everything, so they can convert it and do everything by themselves. I don't mind it at all. Um, so it's very, very cool because you see the hunger in them. They want to learn more. We take them to courses. Here in the office, we sit down with them and like, what would you do, right? I mean, what would you do in this case, right? You're a dentist and you're trained. Okay, doc, so let's do this. Okay, we can try that. Or I know that I tried that before and it doesn't work, or it does work. Beautiful, great job. So it becomes very, very, very nice. It's almost like an educational environment.
That's great. Well, you've talked about navigating rising costs, staffing, and competition. How are you navigating staffing shortages and competition? What are patients in Hula Vista asking for that's different now than, say, even 5 years ago?
Uh, Patients are way more informed now, right? And they have and very proactive. I mean, they come in here knowing they come with scans, knowing brands of implants, knowing techniques. Um, so sometimes they throw you things that are like, wow. I mean, how do you even know this? I mean, you have
And they're more
so
educated then, it sounds like.
way more. Yeah, way more educated because I mean, because it's out there and it's like accessible to all of us, right? So, but they're looking for that now. Before it was like your mom and pops, you come in like, okay, doc, you tell me and we'll go from there. But now they coming in and say, you know what? I want this brand of implants. I want this size of implants. I want this. Boom, 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 boom. And like, okay, great, good and bad, right? Because sometimes they're good. I mean, sometimes we can do it and it's coincides and it's the best treatment for the patient. But sometimes you need to tell them, you know what? Great that you have an idea, not necessarily fits and do that. But in order to answer your question, patients are way more informed. That means that we need to be way more prepared in every single aspect. You need to keep in on top of technology and on top of techniques, on top of financial options, insurances, um, a lot of them. Why? Because patients are asking for it. They're asking you to help them with all they have a problem and they're coming to you like, please help me, right? And let's figure it. So you need to be on top of it, like everything. You cannot stay still, especially nowadays that everything is faster. Boom, 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 boom. So
Yeah, faster, more competitive environment, right?
everything's faster, everything's now.
Okay. How does that play out in the life of a patient? What are their expectations in terms of speed to outcome? What they're expecting of you in terms of number of visits, and how's that evolving how you treat patients?
Yeah. Um for us it's very simple because what we promote and we can deliver 99.9% of the time is teeth in a day, right? So the same day that you don't have teeth or we remove teeth, that same day you're gonna walk out of here with a healthy, functional, aesthetic looking set of teeth that are fixed, nothing that comes in and out. So that's the easy part, right? That's the easy because who wouldn't want that, right? But now the key part there is knowing that it's temporary and it has a healing part and it's easier for the patients to get used to something better, obviously, like any of us. But whenever they want something, again, they want something now, they don't want to wait. They don't want to wait even on healing, right? Unfortunately, we cannot accelerate healing yet, right? So if you need to heal 3 months, we need to heal 3 months, and it's for the good of the treatment, right? For the prognosis of the treatment. I mean, there's not much that we're doing. I mean, you have the teeth and the implants going on in there, but they're healing. So how do we control that on the patients, on the expectations and everything? It's hard. Just having good communication with them and very, very honest communication. Say, well, we talk about this. I know that you're asking me again. Like I thought this was the last time that we're gonna see, and you have my teeth ready and ready to go. Like, hey, I wish I had that easy button and then boom and get it done, right? It's not gonna work that way. And you explain him how and why, and then the purpose of the situation. Nah, I mean, most of them understand it perfectly. They're still gonna ask you the same question again, the same the next visit, obviously. Like, when are we gonna have the final ones? But it's fine. I mean, it comes with the job. It's come with the job. Now, the what to expect, expectations, aesthetically, all of that. That's part of my fun. I mean, that's part of my specialty, right? You're always gonna have that. I know it's very cliche of a dentist, but whenever you see a patient that comes with lacking all of their teeth or missing some of them or in very bad condition, and then you put them in a really good set of temporaries, and the final ones, they're like, but I don't know, this is a little off. I mean, like, come on, man. I mean, I get it that you want everything perfect. You put the before and afters, and it's, I mean, they get picky, a- and with all due respect, that's fine because they're spending a lot of money, time, and effort on it too. So they want it to be, they want to wake up every single day and really love what they see, right? And they're and this, and it's part of my job. I'm trained to do that. Sometimes I'm not as patient as I should be, obviously, but we get it done. I mean, I do my best to get them 100% like satisfied around it.
Great. Well, you're also in a very diverse environment. And what you just talked about is really about trust. So, how do you ensure trust and rapport in a bilingual and culturally diverse market?
That's um that's a big advantage for us, especially in the area that we are, that our first language is Spanish and my staff is Spanish speaking too, is bilingual. It becomes a very nice security blanket for our patients and for my staff too, to be honest, because they feel they can communicate better, and they do communicate better in their, like any of us will do in their native language, right? Spanish is our first language, so it's easier, it's more comfortable. Certain situations are more comfortable. Um, by nature, you create better communication, especially in this type of trips like we discussed that are tend to be expensive. You want to have everything very nice and clear, no doubts around it. Uh, Instructions, all of that. But it's an advantage in our part, um, because patients, even if they understand English and they can speak it, um, but if there's something, there's a little bit that they're uncomfortable of of a fully English office with a Spanish speaking patient, and you have one that speaks in Spanish and the offers the same, they're gonna go with a Spanish speaking office just to be on the safe side, to be in the comfort zone, right? So we actually have our marketing. We have it in Spanish and in English. We come on TV in Spanish and English, and we had a very good result with the Spanish speaking commercials, and we relate to that. As you know, Mexicans and Latin, we're very like like we stick together, right? I mean, like, yeah, yeah, I'm gonna support Mexican. This is Mexican brothers that are here, so that's a big advantage in our part, and we love it. But we get all of it. I mean, all of it. And but it's a big advantage in a way to get patients in, to communicate with them, to within the staff, the cultural the cultural environment around it, the little, I don't know, the chair side manner of just, how was your weekend? Oh yeah, I celebrated, I don't know, Cinco de Mayo, or like, what do you do? Oh, well, so it becomes very easy because we're used to it. It's very relatable.
Yeah, they have a role, right? Yeah, that makes a lot of sense. I think, as a consumer, we're all oriented that way to find a service provider that we fit well with culturally. Well, let's shift this a bit to how you serve patients and specifically through the use of technology.
Hmm.
How have you incorporated digital tools like AI diagnostics, patient education technology, or online scheduling in your practice? Share with us a little bit about that.
All of the above. All of the above. You need to be on your toes, and you need to be progressing. Otherwise, you stay behind.
Right.
So it starts from, like you mentioned, like the AI scheduling on your website and after hours, or it becomes very easy. I mean, the tools that are nowadays are designed to help you out, right? To become very efficient without you physically or having someone physically be there to answer every single thing for everyone. I mean, take a look at the iPhone or smartphones, right? So it's more or less like that. We implement it in scheduling and marketing. That's key. Patients patients work like us, 9 to 5, right? So they're not gonna answer the phone from 9 to 5, but you want them to answer the phone 9 to 5. So it's very illogical to think that they will do that. And you want responsible patients too. So you don't want patients to answer a phone within the work or something like that, right? So AI helps a lot.
So tell me about that. Tell me, let's maybe make it real for our listeners. How do you implement that in the day to day of your practice? Let's pretend for a moment that I'm a consumer. How would I engage with your practice? What might I hear from you? If I were to call and engage with your practice, what might that look like? Tell me how you go about servicing a client in that regard.
It's pretty simple. Very straightforward. We have we have the website that you can literally whenever you want to reach out. That's the easiest way. I'm very from very simple for complicated. Easiest way is, you know what? I need a consultation for dental implant or something like that. You look us up and you can either schedule appointment through our website that does the AI that it directly gives you an opening and options through our schedule, or you can fill up a form, right? And that form generates a list where my contact center, my agents that are here, will give you a call as soon as possible, right? So that's not after hours. But for example, you say, you know what, I'm not sure. I want to talk to someone before I schedule, right? So you send your information. We call you as soon as possible. And one of my girls or agent will call you and say, Kevin, what's going on? How may I help you? I know that you're interested. Boom, boom, boom. And we create a report with you, right? I want to know who you are and if you're a good for the office, as well as you knowing if the office is a good fit for you, right? So that's very key for the office and success, right? I mean, that's the first line of contact, right? You want someone that you can communicate well, that create a good rapport and saying, you know what, do they actually help me, or are they gonna help me or not, right? Because I'm asking for help and you're doing us a favor of actually contacting us. It's not the other way around. The patients in the pool of patients that are out there are doing us a favor of actually reaching out to us. And that has to be very clear to the office, right? We're not like, oh my God, what do you want? I mean, again, no. I mean, like, you're doing us a favor. By you coming in here to the office, we get to live our lives and put food on our table for our families, right? So do your best to treat them well because we're all been there. We're all been there. We all need dental services, medical service, and like that. So that's the treatment. And once you get that report, we get you to the consultation with myself or my brother and my treatment plan coordinator and office manager, and we personally see you. And it's a free consultation. A lot of patients get surprised because we don't charge for the consultation and we take our time, honestly. I I can assure you, I take my time and I love it. Why? And they ask me, why are you not charging? I don't even know if I can help you. Honestly, you come in, we take a CT scan because that's the major tool that is going to give us a full breakdown of everything what's going on and lets me know of what is it that I can help you with, right? If it's whatever would be, right? Even if I'm not gonna treat you, but if I can help you to refer you to somebody else that is gonna help you, that's my job. So, so whenever a patient comes in, say, you know what, how you doing? How's your medical health? Thank you for coming in. I see this, and this. This is the option. This is what I would do in your case, and with my malady from the list like that. And I'm not here to convince the patient of the treatment. I'm here to convince them that whatever I'm telling them I'm convinced about that I could do that for them, not the other way. I'm not convincing like, well, I could do a little crown here. I can like no. I mean, I'm telling you, it can be from all the way from just a single implant all the way to a full mouth reconstruction. Doesn't really matter to me. I mean, honestly, it's as long as I know that I feel comfortable that that's the right treatment plan for my patient. That's I'm good. I'm good, and I'm gonna do my best for my patients to agree and get the treatment done. To be honest, and that's what I tell my staff. Imagine that that was your dad or your mom or a loved one, and they say, "Nah, I don't care," and you just see that there's big old infection or something like that. I mean, why wouldn't you insist? That's your. I mean, if it was your dad, you're like, you have to do it. You have to do it. Let's make it happen. Like, oh, financially, okay, let's figure out something because your health is a priority. Let's get it done. Done. And you insist with a very good confidence around it because you care.
Yeah, interestingly, you've expressed your care and your investment in their time. Free diagnostic is time out of your day that could be doing cases and other things. So, how do you use technology or other accessibility technologies to reduce, for example, the number of no-shows in your practice?
Oh, that's that's a super question, Kevin.
I,
No,
I mean, if they leave you sitting, right, that was an hour out of your day. You could have been working a case that you set a time aside for these diagnostics. They don't show up. That has a material impact on your practice. I'm just curious.
yeah, it's tough. It's tough. You are gonna get no shows. You are gonna get shows, no shows. The AI helps a lot because it gives a lot of options immediately without you physically doing the stuff that you can, like you mentioned. I can be seeing another consultation and a patient can be scheduling a consult at the same time or a couple patients, right? Now, for the no shows, we find it here. We have not figured it out, to be honest. We have not figured out a complete no shows protocol or formula to it. Now, the way that we see it is the quality of the conversation, either text, email, or phone call, that we have with the patient, with the prospective patient, right? So the quality of the contact, basically, right? Say, you know what, Kevin, I tend to be that way. I don't tend to, if I'm gonna go and schedule something, I schedule it. I don't need to talk to anyone, and I'll be there, and I'm actually gonna be there early. So, but at the same time, I noticed that they ask you for a text or an email and they send you like, great, I see, Jaime, that you were interested and you already scheduled. I'm any question, give me a call. Here are the directions for the office. Here are the, I mean, or possible different hours that doesn't work for you. Great. I'll give you, is it okay if I can give you a call a day before, just a reminder or something like that? Great. That's great service that we tend to do that. And whatever whatever method they like to communication, we try to respect that. It's um I like I like when my staff hears the patient, hears what they're not. I mean, they listen to what they're not telling them, right? So if the patient never answered the phone, but they always answer the text, what are they telling you? They're not going to answer the phone. Just text them. Text that's their preferred method. So and text them respectively. And keep in good communication, and always listen to them. And they tell you, you know what, I'll be there. Perfect. But then again, s- still happens. They still happen. And whenever they don't show up, we send a little written letter. I know we're old school, but it creates a bit more of a weight factor. We physically create a, we miss you. We miss you today. I hope everything's okay. Please give us a call to receive your one schedule. Hope everything's fine, or have a great weekend if it's a Friday or something like that. Boom, here's a, and they come back and say, you know what? I just call you because I felt bad, and then or this made an effort. It's more work. It is not as efficient as you mentioned doing an AI, right? But it's you have to be a combination of both because, and I see it that we're so used to AI and technology that we normalize it. It doesn't have so much work sometimes. We see it as spam, right? We can be a spam if we're not thinking about it or if it's not that important in that moment of our lives. But if you receive a letter, oh my God, I remember I didn't show up. Like, okay, let me schedule again, right? So you have round two, but that's you're multiplying that for a lot of no shows and for how long? So
Yeah, those personal touches sound like they're working for you in that way that you're wanting to build your practice and your relationship with patients. You've talked really openly about how you maintain a positive team culture across clinical and front office roles and outside of work. What are some of the hard parts of the business?
it's not easy all the time, Kevin. It's not easy. When everything's going according to plan, it's easy. But whenever something goes wrong, to keep the tone of the office good, it's a lot of work. It's a lot of work because you feel that bad vibe, right? So you need to step it up and gamify it, right? Whenever you create games, um, you get the blood flow going, competitive fun, and you smooth everything out a little bit. So we try to do that every morning. I play a game with like a hot game. Yeah, yeah.
That's great. So, what are some of the hard business lessons that you've learned since opening True Smile?
You need to be really open of getting your ego out of the way. We dentists have a huge ego. We think that we're the best of what we do, and there's nobody better, and there's ever gonna be ever somebody better than us, right? Um, and that hits you quick, 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 quick. So the moment that you realize that you don't know anything about business and anything about hiring or selling or money or taxes or hiring or HR or anything like that, you get humble quick and 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 you need to realize that you need training, the same training that you I mean, we spent years and years training dentistry and zero training in business and hiring and in communication and and how to develop nice systems around it that they're going to maintain your business. So you need to be aware that you're going to invest time, money, and effort on training on that if you want a successful business, right? So we learned the hard way on how to hire and how to fire too, right? Hire quick, fire even quicker, right? Because we're talking about environment, right? A bad environment, a bad apple is going to spread faster than anything that you can imagine, right? And you want to protect that. You want to you want to be a very jealous about your staff and office. You want to protect them. So be very careful who you hire, right? Very, very careful if it's going to fit the environment, it's going to fit the culture, right? Not because it has the best skills ever and is the best accolades on the resume or something like that. It means that it's a good fit. So you mentioned, are you always hiring? Yes, I'm always hiring good people. That's what I meant, right? We're always hiring good people. It doesn't, we're always open for something. It doesn't mean that we're always hiring. It just means that we're always open for good people because that's going to create a lot of value to the office, right? So it's, you need to learn. You need to make, you're going to make mistakes either way. You're going to make mistakes. You want to make them as fast as possible as you can learn the fastest possible. Don't be afraid of go through it. I mean, if you're going through some rough stuff and okay, take a note of it, learn of it. Either you win or you learn, right? Learn the business side, um, and learn to actually confront the hard things about yourself that you don't know. Like if you don't know something, be honest to yourself and tell the staff, you know what? I don't know. We need an accountant. We need an HR. We need a marketing development. It is what it is. Otherwise, you're never gonna grow. You're never gonna grow. You need the smarter people. I mean, there's always someone that has been going through it or gone through it, that it could be very simple. For example, if I get a new dentist that asks me like, "Oh, I'm going through this, this, and this." Oh yeah, I remember we did this and this, and for them it's like, "Oh my god!" Like you don't see it. I mean, you cannot see what you cannot see. Simple, but you need to be radically open minded to be able to explore new options and say, you know what, I don't know. Let's figure it out.
Do you think that it's a gap in the dental school of today to not spend more time on the business aspects of dentistry?
There's a huge gap, Kevin. There's a huge gap. Um, and we talk about this a lot. I mean, my brother and myself, or when my wife or something like that, we talk like, what would you tell yourself if you're coming out of dental school? Would you go into pros, or would you go into the management program first? I was like, I will go to the management program first because it's you'll be able to run a business, and then you can study whatever specialty that you want. But the business side is gonna be give you that stability. So I really think that dental schools and schools in general that are not business, obviously, are lacking that. As simple as knowing taxes, right? I mean, whenever you sell your first treatment, you get that shiny dollar, and they're like, nope, cut it in half, buddy. You're not getting that. Like what? I mean, to that degree, right? I mean, so and then you can get in serious trouble if you don't know that, right? Or something like that. Know the business side. I don't know why schools don't do that. I I want to think is because they don't know better, right? Because my experience was whoever was teaching me dentistry, they learned the same thing as me. Unless it's someone that has their own private practice and went to the business side and is coming back, is going to teach you something. But again, they're not going to teach you something that they don't know. So it's a very vicious cycle around it, and it's very dangerous. But at the same time, if you can do it, it gives you a full, super strong advantage in business because you can be the best biter ever in the world. You can have the best skills. You can do the best dental work ever. But if you don't have any patients knowing you or any patient going through that door, you're not gonna. Nobody's gonna know.
Speaking of driving that value, how do you think about pricing and value, especially in your market? And I know your market spans wide income levels. How do you position on price and value?
It's hard. It's hard because, like I tell my patients, we're not gonna be the cheapest. We are gonna be the best. Um, it's a hard pill to swallow for us and for the patient. But I'm very comfortable with it because I know my numbers. First of all, you need to know your numbers, right? How much is it actually going to cost you, right? The overhead, right? You don't want to be losing money just because you want to be for patients to love you, right? Right? If I tell you, Kevin, you know what? I You're a great guy. I'm going to charge you half of what I usually charge. And then I'm losing money. Like, great, you did a good thing, right? But you cannot be doing that for every single patient, right? Because it's not healthy for the business. Correct. So you need to know your numbers, you need to know your expenses, and then you need to know where are the patients? Where are they telling you, right? Where are they right now financially? What are the options financially that you actually really exist for them and that you can offer them? Because it's different to have an option that you cannot than if you cannot offer it, right? If you don't have financing, if you don't have zero interest, if you don't have and you need to know that. And and once you know that, in my mind and in my opinion, you don't even need to know what the competition is actually pricing, right? I mean, for example, if they're charging half or more or triple, it doesn't really matter at this point because that's I feel comfortable with what I'm charging and my value. and what I can actually do with my pricing and still give the value of the treatment to my patients. Take in mind that what we do here is I don't give him options in quality. I don't give him options in quality of the implants, materials. I'm not going to give you an option on that. Why? Because it's health. And I wouldn't do that to anyone. I wouldn't do that to my mouth. I wouldn't offer you to. I'm not going to do that. So as long as I'm comfortable with the profit, whatever would that mean?
I'm curious, how many of your patients today would you say are referrals from somebody that you served previously? Do you have a feel for that?
Yeah. We do it every week. We crunch the numbers. It's usually around 10 to 20%. That is a good amount. Actually, we love it. And it's very simple. It's very rewarding because you can always sell once, but if you sell twice to the same person, you're doing something right. So that's pretty cool. And whenever they come in and they bring their family members or friends or anything like that, it's very simple because they you don't need to do anything other than thank them. To be honest, go in there and you give more. So, but it comes with continuation of treatment and being loyal to your patients, right? Because we as dentists talk about patients are not loyal to your dentist. Yeah, yeah. Are you being loyal to your patients too, right? I mean, you you got an agreement with them, like you're gonna treat them, you're gonna give them, like in my line of work, I'm gonna give you a full set of teeth for the rest of your life. Are you doing that? Or I mean, did you finish and boom, 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 that's it? And whenever they want to ask you a question about, I don't know, hygiene or something like that, or another, did you return the phone call or not? So you need to be real and do that and really care about the patients. Sometimes it just takes 2 minutes, man. 2 minutes. I mean, it just takes that. I know that sometimes we're too important. I talk about the ego of dentists. Like I'm too important doing surgery or something like that. Like no, it's 2 minutes. Just I mean, they already committed to you and trusted their help w- in your hands, and they pay you tons of money. Like how how ungrateful can you be? Just return the call or whatever, right? So it's that part of it, the care factor around it, and it shows with those referrals from patients because they feel it, right? They feel it. They don't even remember how they were after surgery. And you see them and like, oh my god, I mean, they're all bruised up or something like that. And they're like, no, I didn't feel anything. I was like, okay, great, great. so so it's the experience and how you make them feel. So it minimizes everything.
Yeah, well, Jaime, we always wrap our show with a lightning round. These are quick answers. First thing that comes to mind. Are you ready?
Shoot, let's get it.
Okay, all right, let's go. Let's go. Okay, name one dental tool or piece of equipment you swear by.
CT scan.
What's your favorite leadership book or podcast?
There's plenty, but keeping on the theme, Leaders Eat Last by Simon Sinek. That's gonna help you a lot with it. Another one from Mike McAllowitz. It's called The Toilet Paper Entrepreneur. I know that sounds weird, but it's The Toilet Paper Entrepreneur and Profit First. There's two books by Mike McAllowitz. It teaches you of how to be very resourceful when you don't have a lot of money. So that's good.
Great, great. Okay.
Yeah.
What's one mistake that you made that taught you something valuable?
Okay. Not having clear protocols in the office, not having clear agreements. So whenever you have something very vague, you leave it of everyone's discretion and opinion, and it creates disagreements and disorder. So create good protocols and systems and respect them. Respect them. Otherwise, you just have a paper that is written, not a system.
Okay. And what's the best compliment that a patient has ever given you?
um, you gave me my life back.
Wow.
That's literally something that my patient told me,
That's great.
and it's at the beginning you don't believe it because it's not real to me, but for the patient is wow. I mean, they enjoy life, they smile more, um, and they're happier, right? So my slogan in True Smile is "Smile like you mean it," and it all came back because when I was taking photographs, um, I literally told them to smile, and they go, like you mean it, like, and then they really smile. So, but I remember this patient, Miss Jerry, and she told me like you gave me my life back, and that's very powerful because I didn't see it that way, and obviously she was suffering before to the degree that I couldn't see it, and once we did the change, it worked out really good, and we were very blessed to do that.
That's great. What's one word to describe the future of dentistry in Southern California?
Innovative. Southern California, okay. Dentistry is very innovative right now. It's evolving so much, tremendously day by day. Southern California, it's it's growing fast, fast, fast. There's a lot of dentists going on, and they all are involved in digital or technology that is making dentistry way better and predictable and faster. Not, I mean, if you're not doing if you're doing it as soon as possible, you're late. They want it now. Literally, I'm in this game. I'm in same day dentistry, right? I remember what CEREC. Remember, I don't know if you know what CEREC is. The machine that a mill crowns in 45 minutes or an hour. We're like, oh my god, 45 minutes. Right now, if you wait 45 minutes, is like, my god, I can do that in 5 minutes, right? So everything is very innovative, and you need to deliver now, 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 now. Obviously, with the best intentions and quality around it, but that's the future. That I mean, you're gonna get everything immediate and with the best quality ever. So be ready.
Great answers, Dr. Jaime Estrella. Thank you for joining us and sharing your insights on today's episode of Doc Secret. Thank you so much for being on the program.
Thank you so much, Kevin. I'm very grateful of you contacting me and getting this done, and thank you so much.
Great. Thank you.
Thank you.
If you liked today's episode, please like and subscribe, and most importantly, share this podcast with others you think may benefit from the doc secrets shared here today. Thanks for joining us on today's episode, and we'll see you next time.